This is actually something that we had announced several months ago at the G7 meeting. We determined that this has to be a top priority. This was before the Ebola outbreak. We anticipated the fact that in many of these countries with a weak public health system, if we don't have more effective surveillance, more effective facilities on the ground, and are not helping poor countries in developing their ability to catch these things quickly. That there was at least the potential of seeing these kinds of outbreaks. And sadly, we now see that our predictions were correct. It gives more urgency to this effort, a global health initiative that we have been pushing internationally. Let me just close by saying this. The scenes that we're witnessing in West Africa today are absolutely gut-wrenching. In one account over the weekend, we read about a family in Liberia. The disease had already killed the father. The mother was cradling a sick and listless 5-year-old son. Her other son, 10 years old, was dying, too. They finally reached a treatment center, but they couldn't get in. And, said a relative, "We are just sitting." These men and women and children are just sitting, waiting to die, right now. And it doesn't have to be this way. The reality is that this epidemic is going to get worse before it gets better. But right now, the world still has an opportunity to save countless lives. Right now, the world has the responsibility to act, to step up, and to do more. The United States of America intends to do more. We are going to keep leading in this effort. We're going to do our part, and we're going to continue to make sure that the world understands the need for them to step alongside us as well in order for us to not just save the lives of families like the one I just discussed, but ultimately to make sure that this doesn't have the kinds of spillover effects that become even more difficult to control. So thank you very much to the entire team that's already doing this work. And please know that you've got your President and Commander-in-Chief behind you. Thank you. Barack Obama. NIH address on Ebola vaccine research potential. Delivered December 2, 2014, Bethesda, Maryland. Well, to Secretary Burwell, to Francis Collins, Tony Fossey, your teams. To all of you, thanks so much for welcoming me here today. It is wonderful to be back to America's laboratory, even if I don't always understand what you're doing. Last year, I welcomed Francis and some of you to the White House to launch our brain. Initiative to unlock the mysteries of the mind and to pursue new cures for disease. And Francis promoted me at the time to scientist-in-chief. Which made me very proud, although I sort of felt guilty that I hadn't studied more chemistry. But the work you do here is remarkable, and I just got a fascinating tour of your vaccine research center. I have to say, I was very impressed with how you can clone a virus gene into a vaccine vector. Then subject it to gel electrophoresis. And then pipette the samples into a 96 well microplate. Run it through the world's most advanced multi-parameter flow cytometer. I mean, it was impressive. I've been tinkering around the White House. Setting up a similar system. We use it for brewing beer. But it works well for your work also. Now, the last time I was here at NIH, early in my presidency. I came to announce a historic boost in funding for biomedical research. Because part of American leadership in the world, one of the things that has always marked us as exceptional is our leadership in science and our leadership in research. And here at NIH, you have always been at the forefront of groundbreaking innovations. You've helped pioneer new treatments for everything from cancer to heart disease to HIV/AIDS. And as a consequence, you've helped not just Americans but people around the world live longer, fuller lives. You've saved countless lives in every corner of the globe. And so to Francis and Tony, and all your directors and staff. And the researchers that you fund across the country and around the globe, you deserve great thanks for your leadership. And your service, and your patriotism, and your life-saving work. And that brings me back to today. This past summer, as Ebola spread in West Africa, I told my team that fighting this disease had to be a national security priority, and a priority across agencies and across our government. I realize that here in the United States, some of the attention has shifted away recently. That's sort of how our attention spans work sometimes. Ebola is not leading the news right now. But I wanted to come here because, every day, we're focused on keeping the American people safe. Every day, the NIH is at the forefront of this mission. NIH personnel have volunteered and deployed to West Africa. Some have served in medical labs, testing for Ebola. Some of your clinicians members of the U.S. Public Health Service have deployed to care for healthcare workers who got infected in the line of duty. When Nina Pham, one of the 2 Dallas nurses who were infected, needed treatment, Tony and his team stepped up and you were ready. You manned shifts around the clock. Day and night. You remembered your training. You displayed great skill and professionalism. You reminded the world that it is possible to treat Ebola patients. Effectively and safely without endangering yourselves or others. And all that has made an enormous difference. Like a lot of Americans, I know you fell in love with Nina. She was so sweet and big smile. Her optimism, her sense of service, and she reminded us of the incredible. Sacrifices that our tireless nurses make every day, and we can never thank them enough. And I know Tony thanks Nina for teaching him how to face time. And after she was released, Ebola-free, I was proud to welcome Nina to the Oval Office and give her a big hug. And she's now back home in Texas, recovering, getting stronger. And we remember what she told the world when she was released. Throughout this ordeal, I have put my trust in God and my medical team. And we thank everyone on her team at the NIH Clinical Center who delivered such remarkable care to Nina. But the point is that the work that you have done has continued even if the cameras have gone elsewhere. And the urgency remains, because if we are going to actually solve this problem for ourselves, we have to solve it in West Africa as well. And one of the great virtues of what you've done here at NIH is reminded people that science matters and that science works. It's not always going to be immediate, sometimes it's going to be iterative, and there are going to be some trials, and there are going to be some errors and false starts and blind alleys. But the basic concept of subjecting hypotheses to tests and seeing if they work and being able to document them and replicate them, the basic concept of science and making judgments on the basis of evidence, that's what's most needed during difficult challenging moments like the ones that we had this summer and that we continue to have in West Africa. Last week, just in time for Thanksgiving. NIH and your partners gave us something new to be thankful for, and that was news of the first successful step. Completion of the Phase 1 clinical trials of a potential Ebola vaccine. And on my tour just now, Doctors Nancy Sullivan and Mario Roederer showed me how they and their teams did it. And I have to say both Nancy and Mario were really good teachers and were Very patient with my rudimentary questions, and the lasers were really cool. No potential Ebola vaccine has ever made it this far. So this is exciting news. But it's also a reminder. Of the importance of government-funded research and our need to keep investing in basic research. Because Nancy, as she was talking about the steps that had been taken, showed me this is the kind of mementos scientists keep. I guess is there was some numbers on a little chart from back in 1999, in which she had first done some experiments and trials on the Ebola virus. So this is the product not just of last year's work, it's the product of over a decade of inquiry and work. And at the time, when Nancy was explaining when she first had some breakthroughs in understanding the Ebola virus, nobody really gave a hoot. Until you do. And that's part of how science works. You make investments and you pursue knowledge for knowledge's sake. In part because it turns out that knowledge may turn out useful later and you don't always know when. Last week's news is still just a first step. There are no guarantees. But Dr. Cliff Lane, who is here, is working with Liberian officials to begin large-scale tests in that country. And other potential Ebola vaccines are also in the works. I know that here at NIH you're also working on potential treatments for Ebola. As you move ahead on all these fronts, I want you to know you have your president's full support, and the administration's full support.